Hi, I'm Joe Chili. Mornings from 7 to 9 on Buffalo's oldie station, the Big Weck. Joining us on the Big Weck Buffalo on the Rise today is Cathy Aquino. Cathy, I'm going to make sure I get this right. Vice President of Sales, Medicare and Small Business Markets in Independent Health.
That's it. You nailed it, Joe.
That's very good.
Very good.
How are you today?
I'm doing great. Thank you.
Got your red shirt on. Look at you.
Yeah, we're living in this time of year.
Really?
So, yeah,
it's set you off so well. You know, you talk about this time of the year. This is the annual open enrollment period, right?
Yes, correct.
And it's so confusing to me until I should have known, because I get this big book in the mail yesterday, right?
Mailing
and then
start, yep.
Everybody and their brother is emailing me. You know, time to, look at your plan. But I have to, tell me now, even if you have a plan that you've had for a couple of years that you like, you still should be reviewing that at this point in time, right?
Yeah, during this annual enrollment period, as we just called it, AEP is the three letters that we label it. It's that one time a year that you get to meet with someone, review what that plan is going to look like for next year. So you could be very happy with your plan, but this is when the health plans are making changes to those plans, and you need to understand what that means to you. So if you enjoy your plan and it's working for you, that's great, but you still need to check in with someone just to ask those questions. Is anything changing?
You know, it's like alphabet soup. Part A, part B, part C, part
Sure is.
You know, and I have to tell you, I'm just not that educated when it comes to it. And I think the other thing is, this year, there are a lot of changes from a federal standpoint, right?
Yeah. So the annual enrollment period, I don't think I mentioned, does run from October 15th through December 7th.
Okay.
So as you do go in to meet with people, and for us meeting with the red shirts, there have been changes that have been brought down through the federal government. So it's called the Inflation Reduction Act, Joe, and it started in 2022 and it's been slowly phased in over the last 2 years. But the significant impact of this Inflation Reduction Act for 2025 is going to be with the Medicare Part D prescription coverage. So to explain that is that once a Medicare beneficiary has paid out $2,000 in prescription costs for their prescriptions, what happens in 2025 when they hit the $2,000 is the health plan then will assume all costs thereafter. So it's a great benefit for our consumers, for our Medicare beneficiaries. So with that, and the health plan is having to absorb these costs, that depends on what the plans did to make changes to absorb the cost for 2025. Back to how important it is to meet with someone to really see what's going to be happening with your prescription coverage for next year.
So different plans may find different ways to absorb those costs,
Correct.
basically.
That's right. With plan changes, premium changes, and formulary changes. Again, all part of the package, what you get when you enroll with a Medicare Advantage plan.
And should you be shopping pharmacies as well?
You know, a lot of people ask us that question. Obviously, if you're happy with the pharmacy that you're going to, a lot of them have mail order also, then, stay where you are. But sometimes there are certain prescription drugs that, based on if you don't run it through your prescription card, through your health plan, sometimes you can get it a little bit cheaper, based on the generic drugs and, over the counter. So you probably want to ask, your pharmacist, or go to another pharmacy and just ask, hey, these are the medications I'm on. What would they be if I ran them through your pharmacy? Because,
I got a note, I think a letter in the mail that said, such and such a pharmacy is a Medicare, certified pharmacy.
Sure. Yep.
And on most of the things I don't pay for, you know what I mean? There's zero copay or whatever. But some things, it could be $20, $25 less.
Yes, and to align it with the changes that are happening for next year, Joe, usually tiers 1 and 2, your prescriptions on tiers 1 and 2 are your generic drugs. Tier 1, usually no cost. Tier 2, a slight copayment. But on tiers 3, 4, and 5 is where we're going to see the Inflation Reduction Act changes to these formularies depending on what insurance carrier you're enrolled in. So some plans have a deductible, and then you go to a flat copayment. Other plans have no deductible, you have a co-insurance. So literally I'm telling people this year, Joe, do the math. Do the math and see where you end up based on what prescriptions you are going to be on for next year.
All right, and Independent Health's Medicare Advantage plan for 2025. If people want to understand this, want to meet with a red shirt, are they making an appointment? Are they walking in?
No, because of the changes that are happening, and really we're encouraging to meet with so many of our members, we're just telling folks to either call us or walk into one of our Medicare information centers. always bring your list of prescriptions, understand what your medical usage was this year and what it might look like for next year, and just walk in and meet with a red shirt.
If I walk in around dinner time at your house, do I get dinner too?
No, I don't think so. I don't really cook, Joe.
All right, well, just thought I'd ask that question. All right, so Independent Health is going to help people make a determination for them. And as I said, you know, if it's something, if they have your plan this year or they have a plan from somebody else, they should be meeting with them. But they should be meeting with their red shirts or comparable individuals every year, right?
Every year, just even if it's over the phone or sit down and, you know, have an actual assessment and review, you know, all of the plans. Because at the end of the day, what's going to happen is that, you know, your co-pays could have changed for your doctor's visits, hospital. Again, back to the prescription, very big for next year. So you want to know what you're signing up for. If you don't make any changes and you just stay in the plan, you might be surprised next year. So it behooves you to just sit down with someone and absolutely know what you're going to be looking at for next year.
Don't be lazy, folks. They do all the work for you. I mean, let's
we ask a lot of questions, but that's part of the red shirt review.
That's right. All right.
Yeah.
For more information about your healthcare needs, contact Independent Health, 716-635-4900, www.independenthealth.com/Medicare. Sponsorship and promotional consideration for the preceding segment was provided by Independent Health.